Hello, welcome to Hudson Health. My name is Dr. Ije Akunyili. I'm Chief Medical Officer at Jersey City Medical Center, a facility of Ije Barnabas Health. Today, we talk about something very, very dear to my heart, and that is childbirth, women's health at Jersey City Medical Center. There is nothing more important in any family's life than the birth of a new child, the period of expectancy, some of the anxiety that goes with it, and the joy of bringing new life into the world. And so today, we have a very special guest, Ms. Leah Dungee, who is Director of Maternal Child Health at Jersey City Medical Center, is going to sit with us to tell us all the services we have for our community, our expectant moms, and their families as they navigate this challenging yet very joyful period of their lives. Please stay tuned.
No one plans on heart disease, but everyone should have a plan for it. We help patients of all lifestyles and medical histories plan for healthy hearts. We offer convenient screenings without judgment, hundreds of preventive programs, and women's heart specialists. And we're the largest cardiac surgery program in New Jersey. Make plans for a healthy heart with RWJ Barnabas Health. Let's be healthy together.
Newport, the luxury waterfront community on the Hudson River, offers a quality of life you deserve in one of our many high-rise towers. With amenities such as the on-site Newport Path, light rail, Newport Town Square, 3 playgrounds, dog run, upscale restaurants, retail giants like Kohl's, JCPenney, Macy's, and Target. Morton Williams and Acme Supermarket are just outside your front door. A health and fitness center, skating rink, and medical facilities are also on site. Enjoy the New York skyline from our waterfront and various parks. Manhattan is just one pass stop away, or a quick ride through the Holland Tunnel. Nursery and private elementary schools all on site. 12-screen movie theater at the Newport Center Mall. Looking to visit? Stay at the Westin or Marriott Hotel. For more information, visit us at newportnj.com. Make lasting memories to cherish forever. It's incredible. It's you, Newport. Live like you want.
Consumer Carpets, 3408 Kennedy Boulevard in the Jersey City Heights, your one-stop store for residential and commercial floor treatments, carpeting, linoleum, tiles, laminates, hardwood floors, area rugs, remnants, all major brands, all in stock. Free estimates, same-day installation. Consumer Carpets, it's savings, selection, installation. Credit cards and debit cards accepted. Financing available. Consumer Carpets, price to fit your budget, installation to fit your schedule. On the net at consumercarpets.com. Consumer Carpets, Jersey City, 201-792-2712.
Panapinto Properties, Jersey City, shaping the workplace with state-of-the-art office spaces and addresses your company desires. Building residences that define your home environment, adjacent to all modes of transportation with on-site parking available. The right address, the right lease. Call 201-521-9000 or visit online at panapintodevelopment.com. Panapinto Properties, building Jersey City for everyone.
Welcome back to Hudson Health. I'm Dr. Ije Akunyili. I'm Chief Medical Officer at Jersey City Medical Center, a facility of RWJ Barnabas Health. So today I want to just explore the topic of childbirth, maternal services at Jersey City Medical Center. Might be a little biased, but this is very, very close to my heart. I remember being a young medical student and having my first child and just the anxiety and the concerns. Everything going to be okay? Was she going to turn out well? How will she live in this world? Will we have good services? I'm excited to tell you today that at Jersey City Medical Center, we have all those services for young, expectant moms and their families. We think childbirth is not just an experience that affects women and birthing people, but the entire family, and we want to provide support and services for them. We also understand that in our community, we've had issues of access, people being able to get these services and know that they're available. So today we delve into all things maternal health. What are the services at Jersey City Medical Center? How does a medical and a nursing team support our birthing moms? We also want to tell you about exceptional facilities we have and the new Lord Abbott Maternity Wing. So we're looking forward to exploring all this, but not just the services at the hospital. As you know, it is about an entire journey that goes from the prenatal to the natal and the postnatal period. And our job is to support families safely through all this. At the same time, we acknowledge that in the United States, that among certain population, there is a disproportionate amount of maternal mortality and morbidity. In Jersey City, we're committed to providing women of all birthing ages and races with the care that they need to have the safest, most enjoyable delivery by an expert medical and nursing team. So today I'm thrilled to introduce one of my most favorite people, Leah Dungee. She is the director of maternal child health and very seasoned nurse and a good friend. She comes today to give us her insight on all the services we have, and can't wait for you to meet her. And we talk about how we help women of all types in our community. Now, I know what you may be thinking, right? This is all too good to be true, right? How do you have single rooms and all the services right here at Jersey City, and I don't have to go across the bridge? It is true. I think our community deserves this kind of birthing services. We work very hard every day to bring this information to you, and I'm thrilled that we're going to be able to share it with you today. So please stay tuned.
Comprehensive healthcare is here, here, and here. RWJ Barnabas Health is healing, enhancing, and investing in Hudson County with its two newest locations, Hoboken and Exchange Place. Within walking distance or accessible by mass transit, our locations combine convenience with primary and specialty care, including cardiology, women's health, orthopedics, cancer care, and more. Let's be healthy together.
Panepinto Properties, Jersey City, shaping the workplace with state-of-the-art office spaces and addresses your company desires. Building residences that define your home environment, adjacent to all modes of transportation with on-site parking available. The right address, the right lease. Call 201-521-9000 or visit online at panepintodevelopment.com. Panepinto Properties, building Jersey City for everyone.
Burns Brothers Memorials, Monuments, and Markers, 787 Tunley Avenue, Jersey City. Hudson County's only monument maker, serving all faiths and cemeteries. Design studio and large inventory on site. Cemetery inscriptions and custom orders welcome. Burns Brothers Memorials, Monuments, and Markers, 787 Tunley Avenue, just south of Secaucus Road. Craftsmanship that will last for all eternity. Burns Brothers, Jersey City, Albert H. Hopper, North Arlington. Visit us on the net.
Welcome back to Hudson Health. My name is Dr. Ije Akunyili. I'm Chief Medical Officer, Jersey City Medical Center, a facility of RWJ Barnabas Health. Today, I have the great opportunity of interviewing Leah Dungee, Director of Maternal Child Health at Jersey City Medical Center. Welcome, Leah.
Thank you.
How are you?
Thank you for having me.
You.
Thank you.
So tell our audience, tell us a little bit about yourself and what you do at Jersey City Medical Center. We have a lot of interesting questions for you.
Sure. So I'm a nursing director for maternal child services and NICU at Jersey City Medical Center. I've worked at Jersey City Medical Center for about 12 years. So I am committed to the community, not only the hospital community, but Hudson County as a community. I've seen the community grow and I really like being a part of that.
Well, welcome. And I've worked side by side with you, and it's just great to have you in Hudson Health. So tell us, what makes Jersey City the best place or best choice for expectant families?
Well, I hope you have enough time because there's lots of things, but just to say a few, when we talk about specifically how Jersey City Medical Center can positively impact your birth journey for our Hudson County community, there's a number of things. In connection with Jersey City Medical Center, we have our many health systems areas within Jersey City and also Hudson County that provide prenatal care. We take care of you through the continuum. We do intrapartum care in the hospital, antepartum care in the hospital, and then also postpartum care. You can go to any one of our facilities within Hudson County to get this care, and it's all connected here through the hospital. We also have a number of providers, including midwives.
So in follow-up, we have multiple facilities, some of across the county, and we have physicians, midwives, nurses to follow an expectant parents from their journey all through to the delivery.
Yes.
That's excellent. So if the family was expecting, what would you tell them would be the steps for planning a safe delivery? What would they need to do from beginning to end? Of course, see their doctor or their midwife, but what next?
I would say the next step would be to take advantage of one of the maternity tours that we have at the hospital. During this tour, we talk about what happens from the minute you hit the doorstep until the minute you leave. We have private rooms in our labor and delivery. We have private rooms in our postpartum, state of the art. We have a level 3 NICU for in the event that you need to utilize those services. And during the maternity tour, there's an opportunity for you to ask questions. What do I need to bring? What services do you provide? Can I see the lactation consultant? And all of those answers are yes. We have lactation services 7 days a week. We have nurses that are prepared to give you antepartum support, intrapartum support, postpartum support, lactation support. You start there. And then I would encourage a real conversation with your doctor about what your birth plan is and what you would like it to be. And just see how we can mend that with what happens in the hospital, just so we have the best outcome for you and your baby.
So that's great. As segue into my next question, you talked about a birth plan. Now, something you and your team have implemented is teen birth, a concept of getting everybody together to have one unified vision of the birth plan. Can you tell me more about that, and how do you tell women and they're coming to give birth about teen birth?
Sure. So we do utilize the tours to talk about teen birth. Teen birth is a quality improvement project that we have taken on as an organization to help improve maternal outcomes, making sure that not only the birthing parent, but also the support person and the family feel included as a part of the care team. So the patient doesn't feel like we, as the healthcare professionals, are telling you, this is what's going to happen to you when you get here in the hospital. This is what we are going to do. It's a conversation of, this is the plan. Let's see what you want. Let's see what we have to do. Let's look at the clinical state of you and baby, and let's meet somewhere in the middle.
No, I like that. I think one of the things we try to preach in medicine is that patients have agency, and to get away from being paternalistic, that we're letting them be part of their healthcare decision. And teen birth has also been shown to have good healthcare outcomes overall, right?
Absolutely. Absolutely. We have seen that teen birth has impacted C-section rates, and also our NTSV rates, our nulliparous term singleton vertex. That's for moms who are birthing parents who are having their first baby, for first pregnancies, and decreasing the chance of a C-section if not necessary.
Well, we'll get back to C-section rates in the next segment. So many questions to ask about that. But take me back to this tour. How long is it? How many families do you have? And what's the most pressing question you ever get from new families?
So we have at least maybe about 8 to 10 tours a month. You can access through the website and schedule through there, which makes it very easy. We typically have at least 5 to 6 couples per visit, but we are very flexible. If your due date is coming up very soon and we need to get you in there, we can definitely do that. Our tours are conducted by our lactation consultants. And we show you what happens, like I said, from registration until discharge. I would say our most pressing question is, what do I bring? And just what is the conversation and what happens if I have a preference? So one of the things that we hold really near and dear to us is making sure that we take the patient's preferences into account. And that is one of the reasons why teen birth works so well, is that that's almost exactly what that's doing. So not only are we looking at the safety and making sure that you feel safe and advocated for while you're here as a patient, but also saying, I'm a vegetarian, but I drink milk, but I don't eat eggs. So making sure that we're paying attention to those very small details.
We'll be right back with Leah Dungee in next section. Stay tuned.
No one plans on heart disease, but everyone should have a plan for it. We help patients of all lifestyles and medical histories plan for healthy hearts. We offer convenient screenings without judgment, hundreds of preventive programs, and women's heart specialists. And we're the largest cardiac surgery program in New Jersey. Make plans for a healthy heart with RWJ Barnabas Health. Let's be healthy together.
Burns Brothers Memorials, Monuments, and Markers, 787 Tunley Avenue, Jersey City. Hudson County's only monument maker, serving all faiths and cemeteries. Design studio and large inventory on site. Cemetery inscriptions and custom orders welcome. Burns Brothers Memorials, Monuments, and Markers, 787 Tunley Avenue, just south of Secaucus Road. Craftsmanship that will last for all eternity. Burns Brothers, Jersey City, Albert H. Hopper, North Arlington. Visit us on the net. Consumer Carpets, 3408 Kennedy Boulevard in the Jersey City Heights, your one-stop store for residential and commercial floor treatments. Carpeting, linoleum, tiles, laminates, hardwood floors, area rugs, remnants. All major brands, all in stock. Free estimates, same-day installation. Consumer Carpets, it's savings, selection, installation. Credit cards and debit cards accepted. Financing available. Consumer Carpets, price to fit your budget, installation to fit your schedule. On the net at consumercarpets.com. Consumer Carpets, Jersey City, 201-792-2712.
Welcome back to Hudson Health. My name is Dr. Ije Akunyili. I'm Chief Medical Officer, Jersey City Medical Center, facility of RWJ Barnabas Health. And I have the unique privilege of interviewing Leah Dungee Magnan, Director of Maternal Health at Jersey City Medical Center. So last segment, Leah, we were talking about all things in a tour of the maternity ward. But just tell me, what are the we have several unique features of our Lord Abbott maternity wing. And please let people know, because they may not know how very different this is from many maternity wings in the region.
Absolutely. I think one of the things that makes us stand out is our single private rooms. That is something that we utilized the community and what the community wanted. So our patients have single rooms. They're able to have a support person in there. We have visitation hours. And through that, we have, it provides a family-centered environment. So you don't feel like you're there by yourself and you feel supported. In terms of other amenities that we do have a nice diaper bag that we provide patients that have some little things to take care of you, take care of baby. We also acknowledge that, when baby comes, there's a lot of focus on baby. And we want to make sure that we're focusing on the birthing parent as well and making sure that they are being acknowledged and that their concerns are being paid attention to. We have noise dampening floors, which is great. I know that when people don't usually correlate quiet and the hospital, but we do try to provide a restful environment. So you're able to rest and able to bond. So when you hear, the carts coming down the hall, it's not so loud. We have great views of the
Statue of Liberty.
Statue of Liberty, yes.
Of the Statue of world-class views of Statue
yes.
of Liberty.
So it's quite beautiful. We like I said, in addition to having sleeping arrangements for your support person, there's a refrigerator in the room, so you can, keep food and whatever else you would need to be refrigerated.
What I think when I look at those, the maternity ward, is that there was a very concerted effort to create a concierge curated space for our community and really world class. I wish most people would come see that space. So let's pivot a little bit, Leah. We talked about a lot of the work that went into the tours, the facilities, what to prep. I've interviewed some of the medical team. I know not only do we have a world-class medical enterprise that works hand in hand with your team, we also have a community of learners and residents. How does that entire infrastructure support the birthing parent?
Absolutely. So we do have a very multidisciplinary view, and that's how we approach the patient. That's how we talk to the patient. That's how we incorporate team birth. Team birth is not just about the physician going in and talking to the patient. It involves the primary nurse. It involves the charge nurse. It can include anesthesia if that's what's necessary. And we definitely utilize all of those resources. Being a magnet hospital, we do have certified nurses that are certified in labor and delivery and maternal, child, and also NICU as well, showing the level of excellence in learning and using evidence-based practice when we're treating you and your family.
That's great. Now, something that people talk about has really been integrated into the holistic care of the birthing parent is doulas. I know we've started talking about it and we have some of the services that we're thinking of adding. Can you tell the viewers a little bit more about this?
Sure. So having a doula present in the hospital can help in many ways. Many patients feel a doula is someone who can help coach them through delivery, who helps advocate for them, and then also helps in the postpartum period. So we definitely encourage that. We know that there are a number of resources throughout the community that we are touching base with and bringing into the fold to help our patients feel like they have another person in the room to help support them.
I agree. In fact, RWJ Barnabas Health just went through a system-wide policy that makes doulas available and accessible for patients in the hospital, all in the goal of making maternal care more accessible to this community.
Absolutely.
So let's talk a little bit about cultural barriers that certain patients may have to either being in a hospital, getting care during this birthing experience. What have you seen and how do you navigate this, especially as I'm very proud to have a very diverse community here at Jersey City?
Absolutely. So one of the ways that we best communicate with our patients that speak a different language or from a different country is we use our translation software, which we found to be very helpful. We want to make sure that we are explaining things to patients in a way that they can understand, which is number one is language. So we do acknowledge the diversity within Hudson County. We have a very diverse staff. We also, like I said, use the translation. And like I was saying about the dietary needs, there's very intricate things that can come into that. And through the conversation, through creating a rapport with the patient and listening to what their preferences are and what they want and what they need, we alter the care to be customized to that.
So I have witnessed that firsthand. So in the last couple of seconds I know we are very, very fixated, as we should, on safety for birthing parents and throughout the experience. Tell us a couple of words about how we've continuously improved the safety profile of our hospital for our community.
Sure. Lots of quality improvement projects around C-section rates, around supporting breastfeeding, but not only just breastfeeding, but also safe feeding of your baby. We are the only hospital in Hudson County that have a baby-friendly accreditation, which is wonderful. It shows that the expertise that we have, it shows that we are not only supporting the breastfeeding journey, but also your feeding journey. It's not just, breast is best, it's fed is best. And that is what we are here to do. And like I said, I think one of the most important pieces is making sure that the patient and the family feel included in the plan and what's happening going forward, explaining the why, bringing all of the people into the room that need to be there to help you make those decisions. And if you're not comfortable with it or you still have questions, then we're here to reiterate. We're here to explain it again. We understand that it's a lot of pressure. It's a lot of stress to not only have a baby, but have to make decisions ultimately that can, you need to make within a few minutes. And we're very respectful of that and understanding how important that is.
Well, it was wonderful having you on Hudson Health. Thank you very much, Leah.
Comprehensive healthcare is here, here, and here. RWJ Barnabas Health is healing, enhancing, and investing in Hudson County with its two newest locations, Hoboken and Exchange Place. Within walking distance or accessible by mass transit, our locations combine convenience with primary and specialty care, including cardiology, women's health, orthopedics, cancer care, and more. Let's be healthy together.
Hello, welcome back to Hudson Health. My name is Dr. Ije Akunyili. I'm Chief Medical Officer, Jersey City Medical Center, a facility of RWJ Barnabas Health. I had the unique pleasure today of talking to Leah Dungee, who is Director of Maternal Child Health at Jersey City Medical Center, a highly experienced nurse. And she talked to us about working in Jersey City for the past 12 years and the unique, amazing breadth of services that we bring to this community. High quality, equitable care, really first-in-class facilities. First thing we talked about was access. So access is very important to us at Jersey City because we know that having multiple touch points in the community is the way to get people in that may not feel like they can walk into the medical center. So for the prenatal care, we have that. And in the hospital, we talked about our wonderful single rooms with views of the Statue of Liberty and the unique care we give to each birthing family and their support people. Everything that is done in our hospital is with care and concern to make sure we have the best, most equitable, loving delivery experience possible. But something you heard Leah talk about is how this is a multidisciplinary team. It's doctors, nurses, midwives. We're thinking of having doulas, just the whole group of people, and we package it in what we call a team birth approach. Essentially having multiple people with the voice of the patient in the center about having a good birth and a safe delivery. Now, all this is important, the rooms, the plans, but for us, safety is at the center of everything we do. We have continued to be committed to this community in terms of having the best safety outcomes for both mother and baby. We also have an excellent level 3 NICU facility should the baby need it and stay in the hospital. Hudson County deserves the best. This is a time, like I said at the beginning, where most families are anxious about the outcome. Will my baby be okay? Will this be the right place to deliver them? We are confident that Jersey City Medical Center provides all those services and then not just provides them in a comfortable, culturally appropriate way for everybody. And one last thing that Leah talked about so eloquently was our incredible world-class medical team. So we have a unique team of OB/GYN doctors, midwives, but we're also a center of excellence, meaning that we have residents and fellows, which ups the game for the care we provide to this community. And finally, something we're very proud of, a baby-friendly designation. That is a world-class designation, which being the only hospital in Hudson County, we're proud to have. I'm very excited to have talked to Leah and tell you about all the services we have at Jersey City Medical Center. Thank you for joining us again on this episode of Hudson Health. Have a good day.